We are back. We are here at Beaufort Memorial Hospital, my favorite place in the whole wide world. We are here with Miss Cammie Price. Thank you for joining us.
Thank you for having
You are
me.
living my dream job. You are a physician's assistant, and I'm so excited to talk with you.
Thank you.
How long have you actually practiced as a physician's assistant? And for some people, I think it's an enigmatic kind of career. What do you really do?
Well, I've been practicing for about a year and 3 months.
Okay.
And PAs can see patients on our own. We perform histories and physicals and come up with a treatment plan. A lot of times we'll review it with the doctor if we feel slightly uncomfortable with it or want their opinion as well. And we can prescribe their medications, order any laboratory or imaging that we may need, and we can see the patient and follow up with them.
How does it work here at Beaufort Memorial? Because you said you absolutely love it, and it's you get to do a variety of things. So here at Beaufort Memorial, how does it work? As far as being a physician's assistant, I think one of the things that you do is the Express Clinic. And tell me about that. What is that?
The Express Care is a outpatient clinic where we can see, and we have the capability to see a little bit more acute or urgent problems than maybe your family practice would be able to take care of.
What does that look like? If I'm the patient, who would come to see you?
So a patient who maybe had a minor laceration or maybe strep throat or flu-like symptoms, maybe a strain or a sprain, we can take care of those
So
patients.
my child fell and bumped his head and might need a few stitches, that kind of thing.
Exactly.
Do I need to make an appointment for that, or can I just walk in?
You can just walk in. Some patients will call and make an appointment as well, which we're happy with, but you can definitely just walk into the clinic.
Now, one of the things that you also do, and I have it and I love it, I'm obsessed with it, is my mobile app.
Yes.
Talk to me about that and how that works, and then your role in that, because it's pretty cool.
So the BMH Care Anywhere app is a way to see a physician online through either your phone or your computer.
Exactly.
And Dr. Smith or I can be logged in to the app while we're not seeing patients if we have a little bit of downtime, and we can see the patients just on our computer screen in our office, and we can see more along the family medicine quick visit.
So what does that actually look like for you and I? I would call and you would answer, and what would you ask me, or what would symptoms, why I'm calling?
Exactly. You fill out a little form beforehand, so I at least have an idea of what your chief complaint is and what your medical problems may be, and then I talk to you like it would be any normal visit.
Oh, so you take a little bit of history?
Absolutely. I ask what's going on, I delve into your symptoms more, and make my assessment based on that.
Now, let me ask you a question, and I've always wondered this, because you've got a lot of services that are really convenient. One of my questions is, how do I know which service to choose for what? Is there kind of an overall criteria list you could give me, for lack of a better word, for when I need to go to the hospital versus call?
Our clinic?
Yeah.
Yes. So ultimately, it's up to the patient's judgment. If the patient feels like this is something so severe that they need to go to the emergency department, absolutely, go to the emergency department. We'll see anyone who comes into our clinic, though. But I would say some things like chest pain, extreme shortness of breath, uncontrollable vomiting, to the fact that you can't take any oral intake, major burns, major lacerations. Those are the types of things that need to go
straight
probably
to the emergency room. Okay, that makes a lot of sense. Okay, so then to the mobile app or to the Express Care.
Your cough, upper respiratory infection, maybe UTIs, maybe rash, those types of things. And of course, the provider always has discretion. They may ask if they feel like during your BMH Care Anywhere visit that if they need more information or think you may need more imaging or hands to be laid on you for evaluation, they may suggest that you go seek a higher level of care.
Do you all see folks of any age, or is there a demographic that you basically see, prefer, should see?
We see all ages, absolutely, from infants to the aging population. We'll see anybody.
What is it about being a physician's assistant that attracted you to the profession?
I was really attracted.
Look, she's like, I know this one. Yeah, this is my stuff.
I liked that I was shorter schooling and that I could start working sooner in my life. And I liked the flexibility that being a physician assistant offers. I don't have a residency that confines me to one specialty. I can move around between different specialties as my career aspirations and lifestyle find appropriate.
It was really interesting for me also. You shared a lot about the relationships that you can build. And you said even with the express care.
Mm-hmm. Yeah, you can. It's amazing how you can build a rapport and a trust with a patient in a short visit and express care for a patient you've never met. But it just really means a lot to me and really gives me a sense of purpose when I know that I really did improve somebody's day, even if it was through a short interaction.
And once again, you are in collaboration typically with the physician. How does that work?
Absolutely. So if I have a question for the physician, I'll go talk to him after I evaluated the patient. Sometimes I'll have Dr. Smith even come in and also lay hands on the patient, do an examination, and get his input.
So it really is a team
Absolutely.
approach. It's wonderful. It's great to talk to you.
Thank you so much for having me.
We thank you. We thank all of you for joining us here on Girl Talk. Have a great week. Bye-bye. For more information about Beaufort Memorial Express Care and Occupational Health, visit BeaufortMemorial.org or call 843-524-3344.